Hi everyone, I'm Dr. Karam. I'm a board-certified facial plastic surgeon, and I specialize in facial rejuvenation, which ultimately means I help people look as young as they feel. I want to take you through the menu of services that we have in the facial rejuvenation offerings and what each procedure is directly trying to treat so that you understand as a consumer out there and trying to navigate your way through the aging process, as well as try to understand what procedures you should consider trying to combat the aging process. You'll understand the rationale and the wisdom behind it. Just very, very briefly before we launch into it, I'm just going to break down the framework of facial aging and give you a context which everything else that follows fits within. There's three verticals of facial aging changes. The first one is related to changes happening to the level of the skin. That's discoloration, fine lines and wrinkles, breakdown of collagen and elasticity, dullness, lack of light reflection. Those are all sort of skin level changes that are happening with aging. And that process really starts in our 30s and continues on. The second vertical or category is related to volume loss. That is also something that starts in our mid to late 30s. That happens as a result of fat loss, in different parts of the face, which we'll talk about when we break down the fat transfer or fat grafting procedure. But suffice it to say, there's about 14 different areas throughout the face that lose a little bit of volume as time goes on. And as a result, the face becomes gaunt and deflated looking. The third category, and this is the one I think most people define aging as, is when the tissues start to sag. When you start to see that very youthful V-shape jawline and heart-shaped face start to give way to more of a square or even a upside-down triangle where things are thin up top and heavy down below, and a sagging of the neck, etc., and loss of your profile and loss of the jawline contour. Those are the things that really kind of make people panic. They're like, wait a minute, I no longer look like myself anymore, and as a result, lead them down the path of trying to investigate what type of treatments should I have done, and unfortunately, there's so much information out there, so much, some of it's just straight misinformation and marketing hype that it makes it very hard for an individual to understand what they should be doing. And what typically ends up happening is you run down these different pathways, usually dead ends, usually spending a lot of money, usually not getting results, and oftentimes leading to deformities and unnatural looks. For example, when people try to use fillers to try to fix laxity, they end up with fillers in their outer cheeks and their jawline and end up looking like heavy and puffy and unusual, and they never had that look before, but they do now, and it's very hard to correct those type of problems. Or they go down the road of trying to do resurfacing or energy devices like Ultherapy and Morpheus and all these other things to try to lift the sagging tissues, and unfortunately rarely be able to even make a dent in them. Oftentimes end up depleting a lot of their savings and their financial resources going down these routes. So this is going to give you a little bit of a clear direction, at least of the procedures that I offer and how they directly affect the aging process. So in the category of sagging, the areas that you start to see it are the outer brows, the mid-face, jawline, and neck, and that's because the fascia is elongating, almost like pizza dough. If you let it hang upside down and it gets longer, that's what's happening at the fascia level. But in the direct middle part of the face, you're starting to see the same effect happening to the upper eyelids, lower eyelids, and the lip, and even the earlobes, believe it or not. So those are changes that are all happening simultaneously to affect the face. And another kind of general part that affects a lot of people is aging of the hands. What happens in the hands is the same kind of things. You get loss of volume in the hands, so you start to see that thinning and tendinous look of the hands, as well as the discoloration that comes from sun exposure. So the general sort of approach categorically towards treatment in my practice is to assign a very specific treatment associated with a very specific change. I don't look at it as one thing fits and fixes everything. For example, sagging of the fascia of the outer face, components of the lateral brow, mid-face, jawline, and neck, that's all treated with a vertical restore, for example. The laxity that happens to the eyelids, that's treated with eyelid blepharoplasty. Upper eyelid blepharoplasty for the upper eyelid, lower eyelid blepharoplasty to remove the extra skin and fat, or a skin pinch depending on what the anatomy is, to treat the lower eyelid. The volume is treated with the use of fat transfer to fix the loss of volume throughout the face. It's not meant to lift the face, it's just meant to replace some of that lost volume. And then the distance of the upper lip, that gets treated with an upper lip lift. And then when people have elongated earlobes, we treat that with earlobe reduction. When you restore a kitchen, for example, it doesn't make sense to replace the countertops, replace the appliances, but leave the cabinets, the flooring, the ceilings, and some of the other fixtures the same, does it? It's the same thing with the face. When the face begins to age, in order for it to look balanced and complete and truly renovated or restored, you need to treat all of these different areas simultaneously. That's always been an important factor of leaving my outcomes looking very natural, and that is the centerpiece, I think, of our facial rejuvenation practice. It's being comprehensive and being mindful of how these different parts are going to look next to each other. If something doesn't need to be done, of course we're not going to do it, but if it needs to be done, it's better to do it at the same time. The vertical restore, just to make a quick point of differentiation, it is not a facelift. A facelift is a traditional technique which pulls the face sideways and it tightens up the jawline. The vertical restore is a package of 4 different procedures that are used to create comprehensive harmony and balance to this entire area. This is what you do in the mirror when you kind of go up like this with your face. You're going all the way up here, you're running into a roadblock here, things get a little backed up, you lift it up like this, the neck comes up with it, you're getting a vertical restore essentially with what you're doing. How does it differentiate from a facelift? The traditional facelift is what's called a smaz technique, where they're going under a superficial layer of the fascia. The deep plane is what the vertical restore is based of, and it goes from, enters a plane in a diagonal from here, releases all the ligaments of the face, releases all the ligaments of the neck, lifts the face, jawline, neck, and lateral brow all together without pulling against the soft tissues. That's a very, very important aspect and point of differentiation. Faces don't look pulled. That's why they look so soft and natural as a result of the lift. And that's a trademark procedure, and I trademarked it primarily because, number one, I didn't want people out there saying that they're performing this procedure when, in fact, this is a culmination of a lot of little details that it's not something that can easily be transferred and taught, and you certainly don't want somebody misguiding somebody by saying, hey, I perform a vertical restore, and giving you completely different looking outcomes. So those are the general sort of approaches that we take. It's a very mindful, step-by-step, look at the entire face, put everything together, and address it in a balanced and harmonious way. As far as the skin goes, I typically put my patients on a comprehensive skincare regimen. Recently, I developed the Karam MD trifecta, which basically brings it all together and makes it very simple to use in a 3-step process. Otherwise, you have to get these individual products separately, which makes it a lot more cumbersome and more expensive. But certainly, that's an option available. But you want to do a daily skincare regimen. Be great with sun protection. Be great with diet and exercise. Keep yourself healthy. Keep your skin healthy. And then if extra things need to be done, we can do them at the time of surgery with lasers and different things like that. All right, folks, I hope that gave a little bit of clarity and understanding about how the overall program works and how the regimen works. If you have any questions, jot them down in the comment section below. I'll be happy to answer them. Make sure you subscribe to the channel, like it, and share it so we can get this out to more and more people, which ultimately I think is going to help people really figure out how all this stuff fits in to the overall anti-aging process. Thanks so much.